leaders that cared so much about their team members and safety, but also about being able to respond and being able to support our clinical team, our emergency room. It was a really giant effort by everybody to be able to respond.
I know. I've never seen such teamwork, and I know we see teamwork, but
yes,
it has been absolutely phenomenal. Absolutely phenomenal.
Agree.
So, Liz, the next podcast we will talk about chemicals, PPE. We'll get our vendors in, and we'll get one other item in, and let's discuss that, and we'll talk about that in the podcast. And of course, the topic will be COVID.
It's COVID, yes. And I think a lot of people remain very cautious. We're waiting to see as both federal and local lifts begin to happen, and how there's less restrictions, and how we have to help our leadership team start with the social distancing. And as patients return to our hospitals, as we begin to see some outpatients that need care and treatment and imaging, and surgeries, we start to accept more patients into our hospital, so we can talk about how we are ensuring their safety when they come in through not just our emergency room, but they come in for additional services. So I would love to have a conversation to continue about how we're keeping our environment safe. And of course, disinfecting and the disinfection process is all about that, how we're going to continue the safety and integrity of all the environmental services in the hospital.
Yes. And I know we began getting ready for getting regular patients back in, and so cautiously we're doing this.
Yes. How wonderful was it when we began to see some of our patient doors and corridors open again, and patients beginning to walk around the corridors to get some exercise, towing their IV poles behind them.
Yes.
It's just been really great to see less and less COVID patients and some healthier patients come and return to our hospital. Still not healthy enough to be at home and treated as outpatients, but healthy enough to where they were not under isolation for COVID. I recently, a couple of weeks ago, did my very first patient room visit where I spoke to the patient about cleaning and how we're doing to keep their room clean, and they couldn't be more complimentary of environmental services. And we're very empathetic about what our team members have been through in the past 4, 6, and 8 weeks. So
it's so funny.
It was really great.
That's one of our topics we left off at, patient rounding. And I was thinking about that the other day, and how I had such a great idea with patient rounding, and it just crashed and burned, I think 2 weeks later. I think the Wednesday when we were planning to do our podcast, this started. And we couldn't make it.
Yes. And here we are. It took us some time to be able to get back and be able to sit together and record. And let's talk about that, too, because our podcast recording has changed. We were together in the same podcast recording studio. And now you are in your podcast recording studio, which I understand you had a little bit of free time to decompress from COVID-19 responding in the hospital, and you had some time to work on your studio. I'd love to be with you and in the same room and see that, but we are now recording from separate locations to make sure that we continue to be safe and practice safe social distancing and still yet be able to record this.
Well, thank God for technology, too, because if we
Yes,
weren't
and
able to have this technology, we wouldn't be able to have this conversation. So, Liz, thank you for joining us again, and me joining you.
Yes, and we look forward to welcoming some guests next podcast, where we're going to talk to some folks that supported us through this pandemic and supplied us with needed disinfecting wipes and supplies to be able to clean and disinfect. So that's a great conversation that we're going to have.
And
Good
we
to
could
be
also
here.
talk about supplies and how hard it was to get some.
Yes.
Our hospital, luckily, was able to manage to always have supplies, but the supply chain had to distribute to all other hospitals everywhere, even grocery stores and the Home Depots and different places like that, that, our supply chain struggled a little bit.
Right.
But we were able to be successful. So thank you again.
Thank you, Dion. Before we go off, we'd be remiss if we didn't thank, we've already thanked our EVS, hardworking EVS team, but we really need to thank all of the truck drivers that without them continuing to work and continuing to deliver supplies, we could have never done our job. So I just want to take a couple minutes to thank all our truck drivers and thank the public transportation first responders. Thank
Absolutely.
you.
The bus drivers, the buses that I've
Yes.
been in. I'm talking about the stores I've went to that's been open. I'm not going to call their names, but the big box stores that we were able to go into and get supplies that we needed. They're all frontline, hardworking staff members who put themselves out there to help get us through this.
Yep, great. So I look forward to our next podcast and our next conversation.
All right, thank you,
Until
Liz.
then.
See you in a week or so.
We ended with stay clean, and now we're going to end with stay healthy.
Stay healthy.
Stay healthy.
Thank you. Bye-bye.
Thank you.